Okay, we're continuing with the book here, Prevent and Reverse Back Pain by me, Pete Rogers. We're on part 4 of the book. So the next quote, we just talked about abbreviations. DDD means degenerative disc disease. So besides ischemia, lack of blood flow, what else causes DDD? Obesity, because when people are fat, they're usually hypertensive and have a lot of atherosclerosis. Often diabetic. Trauma can cause degenerative disc disease. I've seen a lot more of it, like in football players. Some car mechanics having an awkward job, working in awkward physical positions. Okay. Poor posture, excessive sitting with lack of exercise, smoking tobacco, muscle weakness, paralysis. They get more of this stuff. Let's see, what else am I going to tell you? The same high-fat diet. People say genetics, but things are seldom genetic. Usually when somebody says genetics, it just means that the whole family eats the same bad diet. Okay, where can you see more examples? If you ever want to look at an x-ray film of anything, the best free site that all the radiologists use is called Radiopedia. It's run by a neuroradiologist, and he's got reasonably good images on all the common stuff. So if you ever need to look up a radiology finding for free, look it up in Radiopedia. That's what we use. That's what I look up. I've been studying radiology I've lost track how many years. Okay. And it's all free. You don't got to sign in. You don't got to give them your email, anything. Okay, what's unique about this particular book that I'm teaching? My spine book. Well, I'm the best expert on spine in the whole world. I figured out this whole thing. I explain it to you in a big picture. See, when you talk about a radiology book, like let's say you read a radiology book about the spine, they'll have an arrow pointing to the finding and say, this is an osteophyte, this is a disc protrusion, this is a disc extrusion. Nobody ever puts together the pathophysiology, explains what causes the problem. What is the sequence of events that leads to this problem? How could we intervene earlier in the chain of causation to prevent this? How could we intervene now to minimize our pain? Okay? And so, like I'm saying, I just figured out that degenerative disc disease, DISH, diffuse idiopathic skeletal hyperostosis, ossification of the posterior longitudinal ligament, OLF, ossification of ligamentum flavum, interbody fusion, and Bostrom disease. They're all the same thing. The spine is just growing bone to protect itself from segmental instability. That's it. That's the big concept. And also it happens because the ligaments are weak due to things like caffeine, glyphosate, fluoride, for example, tobacco. Okay, here's a painting of Isaac Newton during his Eureka moment about the refraction of light, painting by Pelagio Pelagi from 1827. Beautiful. Okay. And that was kind of my Eureka moment. I'm looking at these cases and I'm like saying, it's all the same darn thing. DISH, DDD, OLF, Bostrops, it's all the same thing, OPLL. Okay, I've never seen anybody else put this all together. I've studied this stuff and read everything on it for years, for decades. Okay, I used to run a whole spinal injection clinic. Okay, in the modern world, it's drowning in atherosclerosis. Why for so many years do people pretend that atherosclerosis has nothing to do with the spine? And it directly correlates with age too. The older people get, the more of the stuff they have, just like it is with atherosclerosis, hypertension, diabetes. Okay, everybody's always looking for disc herniation, but the answer is right in front of you like it always is. Hypertension, diabetes, atherosclerosis. And they got all the other things that go with that. So to me, it's obvious, and I put it all together. Okay, let's see. This book explains how you can get better, how to improve blood flow, how to avoid these other problems with the ligaments. So let's just say it took me over 25 years to put this all together. Let's see. So basically, the way you start to help a patient get better is you have to improve blood flow. And what are you going to do to improve blood flow? You need to minimize dietary fat, you minimize dietary sodium, and then you want to avoid all these toxins to the ligaments, like the glyphosate and non-organic foods, so you got to eat organic only. The fluoride, so you got to filter your water with reverse osmosis or distillation. I made other videos about that. You want to avoid alcohol, tobacco, and caffeine. They all can be damaging to your ligaments and weaken them. Okay, and so it's like, ask not what your doctor can do for you, but what you can do for yourself. You can get more sunshine, you can exercise more, walk more, you can optimize your diet, avoid all these things, eat the good stuff, low-fat, vegan, plant-based diet, organic only with no oil. This is all pretty easy to do. So anyways, I'll talk about all these things in much more detail with the next lecture. Hope you found that helpful.